Dean, I just wanted to ask you and just see how you feel about going through the treatment. And you finished a few weeks ago. In the meantime, he's always had temporary teeth, temporary bridges. We call them interim prosthesis. And so you, even from the inception, had teeth to chew with.
Right.
But not as stable, not as strong, and not as functional. So now with your new teeth, which are porcelain teeth, individual porcelain teeth on a titanium milled framework to hold the gum tissue and the porcelain teeth in place. These are the highest level of dental treatment prosthesis that is available. And it's really amazing from aesthetics and also from a functional and longevity point of view. So with your new teeth, regardless of knowing all of these details, how are you doing?
Doing really good, really good. Everything's working fine, no issues, and very happy that we got this, went this way and got the process completed.
And of course you get to know patients very well over the time period of treatment. So I know that you're a real foodie and that you really appreciate and know good food and go to restaurants a lot in your business and personal life. So how has this improved it, or is this just kept you moving forward, or how do you feel?
I think a little of each. Obviously, it's improved it for sure.
This process that you have is something I've worked with my laboratory and over the past several years to create this final prosthesis or product, which I think is the most advanced that's available. But dentures only give about 25% of the biting and chewing force, and dentures also allow the bone to shrink up and get less and less. So there is a time when dentures just aren't going to fit anyone. And dental implants can either have a resin, titanium bar fixed bridge, which is very good, but somewhat limited in lifespan. And then we have the titanium milled frame and the porcelain teeth, which is essentially has the ultimate longevity and isn't going to wear down. Sometimes we call them unbreakable teeth. So it's really a good option. I'm always excited to do that, and I think that you and other patients that do that have the best end product and treatment that will give them the best quality of life as they go forward. I think you had a lot to do with picking the teeth and how they look.
Yeah.
So
Color, size, teeth, design,
Yeah.
etc., etc.
Yeah.
A whole book full of choppers that you can choose from.
and your wife enjoys the new look.
Yes, absolutely.
That's sometimes the most important part. So.
Yeah.
Well, we're going to continue to see you for what we call continuing care and cleaning. The implants, it's just like teeth, they have to be cleaned periodically, and so we'll be doing that and look forward to working with you. But thank you for, I enjoyed taking care of you greatly, and you have a great sense of humor and very intelligent and fun.
Well, thank you.
Keeps me on my toes.
Yeah, well, thank you.
I had had a couple of evaluations by other dental implant surgeons, and I had not got a good feeling for the direction they were going and a good picture of it. Dr. Smith provided the best viewpoint of what was going to happen, what the options were, and what I could do. And so at that point I thought it was the right time, right place, and the right facility. At that time it was becoming more difficult to eat and do things. I had severe, bone loss, and the teeth were loose, so I had to be careful of what I ate, how I ate it, and it was starting to impact the way I was appearing to other people more and more dramatically. Well, now it's a solid foundation, a good set of teeth. There are differences in cleaning technique, but I have a great deal of strength there and able to do anything I want. My appearance is a lot better, and I think that all in all, it's better for my health. Along with the problems I have with teeth, I think it has an impact to your overall health of yourself, your body. This was probably the primary reason to come here to Dr. Smith, was that it was an all-inclusive viewpoint. The other dentists that I had talked to were all looking at a partial. One would do this and one would do that, and they'd get together and talk about it. And I didn't have a clear picture that there would be interface problems with multiple people involved. And so with Dr. Smith, having the confidence that it was all going to be done one place with one person with a skill level and experience level that he had, I felt much more comfortable. I was resistant up until that point. Just because you go into one office and you'd have to wait while they talked it over and then go to another office and things like that. So it was much more beneficial here. Cost is probably significant for a lot, although my personal viewpoint is that it is your health, your welfare, and your quality of life that's at stake. And so it wasn't as much a cost issue within your affordability range as it was about your future and your life. I feel a lot better. My health is a lot better. The condition of your teeth has been traceable to a lot of different areas, cardiovascular and other areas, that I think is correct, because I feel much better after I've had the operation and restoration. The staff's been great. I don't think I've caused them too much problem. They've actually been great. It's like coming into a family environment and everybody cares and talks about you, knows what you do, everyone gets along. So I think it's a different environment than in the normal system out there, and it's much more beneficial. It is people oriented, and so it's been a real enjoyable experience as far as it goes.